नमस्कार, मैं प्रोफेसर अमिताभ बनर्जी, यूएचओ का चेयरपर्सन क्यूवाई प्लेटफॉर्म से आपसे बातचीत कर रहा हूं। और आज एक हमारे पास विशेष मेहमान है, एक गेस्ट है जो कि यूरोप में 2 यूनिवर्सिटीज़ में प्रोफेसर रह चुके हैं और हेड ऑफ रिसर्च रह चुके हैं। और जब महामारी चालू हुआ तब उन्होंने कुछ अपने ओपिनियन दिए कि ये लॉकडाउन के विरुद्ध ओपिनियन दिए या जो भी दूसरे मेजर्स लिए जा रहे थे उनके अगेंस्ट उन्होंने अपने ओपिनियन दिए कि ये साइंटिफिक नहीं हो रहा है और हाई रिस्क ग्रुप अलग है और जिनको रिस्क नहीं है, स्कूल क्लोजर या दूसरे लॉकडाउन्स ये अनसाइंटिफिक है। तो उनके लिए उनको काफ़ी ये सैक्रिफाइस करना पड़ा, उनको काफ़ी हैरेसमेंट हुआ अपने यूनिवर्सिटीज़ में, उनको यहाँ तक कि उनको यूनिवर्सिटी से निकाल दिया। तो ये आपको मालूम है काफ़ी ऐसे देशों में हुए हैं और उस हिसाब से हमारे देश में इतना नहीं ज़्यादा रिस्क, मतलब जो वेस्ट में हम सोचते हैं कि वहाँ पे शायद ज़्यादा फ्रीडम है या लिबरल है, ऐसा नहीं है, उनको फर्स्ट हैंड एक्सपीरियंस है। और दूसरा, आज वो हमसे बातचीत करेंगे, अंग्रेजी में बातचीत करेंगे क्योंकि उनको हिंदी नहीं आता है, तो हम थोड़ा बहुत कोशिश करेंगे उनको हिंदी में वो जो बोल रहे हैं उसका जो मुद्दा क्या है हम समझाने की कोशिश करेंगे। आज वो बहुत ही इम्पोर्टेंट चीज़ में बात करेंगे कि अभी वो खुद वहाँ पे रहे हैं, उनका एकेडमिक कैरियर यूरोप में बीता हुआ है और वो यूरोपियन जो वेस्टर्न मेडिसिन है उसमें क्या क्या सीमाएँ हैं और क्या क्या बायसेज है उसके बारे में बात करेंगे। तो मैं अभी उनसे बातचीत करना चालू करता हूँ। वेलकम प्रोफेसर सैम ब्रोकेन, वेलकम एंड इट्स अ प्लेजर। या नमस्कार। सो ये सैम ब्रोकेन है। तो फर्स्ट क्वेश्चन सैम, आई विल बी आस्किंग यू, firstly you can just give a brief overview of your background and what are your core competence, then we will be asking you what are your views on your experiences. Yeah.
Thank you for inviting me, Professor Amitav. It was very nice for your invite, to receive your invite. So who am I? I'm Sam. I'm originally from Belgium. Got a first degree in physiotherapy, started in a practice, started studying again afterwards, and became an osteopath, which is closely liaised to chiropractics. Did some postgraduate studies in sports and exercise sciences, got my degrees in that, also in occupational health and safety. Went back to private practice and working in clinics, and after about 10-15 years I started realizing that what I was doing wasn't really beneficial. So I was like questioning myself all the time. So how is it possible that my patients don't improve the way I think they should improve? What I was taught at university didn't really seem to work in practice, and I found one peculiar thing, and that was that people were made extremely dependent of health treatments, and this buggered me a bit, and I was confused. And so, to give you a simple example, if someone came in with a neck problem, musculoskeletal issue, they wanted me to manipulate their backs or their necks, and I said to them, "This is not going to help you in the long run. You know, this is just a temporary symptomatical solution. The only way to safeguard a good neck stability, and if you lack this, then you need exercises." And then I started something peculiar. I gave patients a 3-minute exercise, nothing more, every 3 days. So very simple and very short, just to train specific muscles in the musculoskeletal system. And I saw them back in my clinic after a month. And then I asked them, "Could you please perform this exercise?" And in 95% of the cases, people didn't know the exercise. So they forgot everything I told them 1 month ago. So that was a proof for me that people were made dependent on the healthcare system. You are the health professional, you solve the problem. I'm not taking care of my own health. And we see the results nowadays in the broad scope of medicine. So then I went back to university, went to the UK, studied public health, health promotion, and epidemiology, and did my research degree there, and came back to Europe and was appointed in 2 university colleges, as you mentioned before, in which I tried to at least motivate my students in guiding patients instead of treating patients. You know, if you want to obtain an optimal health, only the symptomatical approach won't work. And that's what we are currently doing in Western medicine, is treating symptoms and not the root causes. So that's in a nutshell my whole story. Yeah.
That's very interesting. तो I will just हिंदी में मैं थोड़ा अनुवाद करके बताता हूँ. प्रोफेसर सैम ने बताया कि वो जब प्रैक्टिस चालू किए, वो एक एज अ फिजियोथेरेपी, क्लिनिकल फिजियोथेरेपी जब प्रैक्टिस चालू किए, मरीज आते थे, उनको गर्दन में दर्द या कुछ दर्द, तो उनको वो एक्सरसाइज सिखाते थे कि वो कैसे एक्सरसाइज करके अपना खुद का बीमारी को दूर कर सकते हैं, लाइफस्टाइल चेंज करके, एक्सरसाइज करके. पर जब वो 2-3 महीने बाद जो मरीज लौटता था, और जब डॉक्टर साहब पूछते थे कि भाई आपको एक्सरसाइज याद है, करके दिखाओ, 95% लोगों को एक्सरसाइज नहीं मालूम था. मतलब वो चाहते थे कि आप दवाई के ऊपर ही भरोसा हो, उनको दवाई से ही ठीक होना है, खुद का एक्टिव कुछ नहीं करना है. They want to lead a passive lifestyle instead of active, taking care of their own health in their hands. तब जाके उन्होंने और अध्ययन किया, उन्होंने और डिग्री हासिल किया पब्लिक हेल्थ में, एपिडेमियोलॉजी में. उसके बाद वो बेल्जियम में आके उनको 2 यूनिवर्सिटीज में हेल्थ रिसर्च का ये मिला. So now, Professor Sam, I'll be asking you some questions about what are your experience like from here, from Asian countries, from the Eastern Hemisphere. We think Western medicine is very advanced, and what are your experience? What are the people perception of Western medicine, or what are your experience? What are the limitations or biases, as you say? What are the biases in Western medicine? So can we get your first-hand experience? What are the best things about Western medicine?
Well, I've been living in India for almost 4 years now, and let's take the traditional medicine, like Ayurveda or the Ayush in general, is being regarded in the West as pseudoscience. And the thing was, once I started doing research, I found a lot of quite good to even very good published research in peer-reviewed journals that came to the conclusion that the approaches of Ayush were at least as effective, and in some cases even more effective, than the Western approaches. So for me, this was already a staggering finding, because it's completely neglected in the Western countries. Ayurveda is being considered as something of a fraud, as well as the other Ayush incorporated sciences, which is totally untrue. People seem to forget that Western medicine only has been around for nearly a century. And within that century, if you look at the history, how it came to evolve, the allopathic model, it was completely biased from the start. It was aimed at leaving all the knowledge that we had up until 1920, to just throw it overboard and instate a model that was aimed at financial profit. We can dive deep into Rockefeller and the Flexner report, etc., but that would take us too long. But the essence of the story was that one rich man, Rockefeller, saw a huge potential in using chemical drugs, and instated a model in the United States that medical colleges had to follow. And if they didn't follow that new chemical approach of health, namely creating drugs and feeding them to people, all these universities that didn't comply back then with that novel approach were basically dismissed and went out of business. And only the ones remained that followed suit of what Rockefeller proposed, namely only using chemical drugs. This is a bit of a simplified story, but otherwise I can give a lecture of 2 hours about that. And that's what happened. And he was so powerful that he went over to the predecessor of the WHO, which was called the League of Nations. And he implemented that system there. And he was so powerful that all countries blindly started following that approach. We may not forget that Ayush, in general, has an experience of 6,000, and some scholars even claim it's longer than 6,000 years of experience. And although it's not scientifically underpinned, the constant knowledge transfer from generation on generation throughout these thousands of years has created a compendium of knowledge that is much more efficient, much more strong than a lot that what Western medicine has to offer. And I always state to conclude when I talk about this, if you look at the Western medicine as a whole, then we may be very lucky that we have it. Why? Within the acute medicine, that's the best we can have. You know, if I break my leg or I get run over by a car, I will be so happy to have a good orthopedic surgeon that is capable of restoring my bones. That won't be solved with an Ayurveda treatment. So in general, what I consider surgery and acute medicine, Western model is top. But when it comes down to lifestyle diseases, and then we see that if we look at the data, they don't succeed in anything. They don't have any solution for lifestyle-related diseases like cardiovascular diseases, obesity, and the figures prove it. You know, the last 20 years, we saw a huge rise in obesity. We saw a huge rise in cardiovascular incidences. We see a huge rise, and certainly in India, in fatty liver syndrome. The Western model doesn't have an answer for that.
Thank you, Sam. That's a very good perspective and very insightful. प्रोफेसर सैम कह रहे हैं कि वेस्टर्न जो साइंटिस्ट है, वेस्टर्न एकेडमिक्स है, वो हमारे जो आयुर्वेदा वगैरह को सूडो साइंस समझते हैं, पर उनका खुद का जो एक्सपीरियंस है जब यहाँ पे आए, वो 4 साल से भारत में है. जैसे मैंने बताया था कि कोविड के दौरान उन्होंने फ्रैंक बातें की हैं, अपोज किए थे लॉकडाउन को या दूसरे कोविड मेजर्स को, तो उनको नौकरी से निकाल दिया गया था. तब से ये 4 साल से ये इंडिया में है और उन्होंने यहाँ पे आयुर्वेदिक का थोड़ा बहुत देखा, तो उनको लगा कि इससे क्रॉनिक डिजीज, लाइफस्टाइल डिजीज में काफ़ी फायदा है. और उनका कहना है कि जो मॉडर्न मेडिसिन है, एलोपैथिक मेडिसिन है, वो खाली 100 ईयर्स, 100 साल पुराना है. एंड जबकि आयुर्वेदा एंड ऑल 6,000 से भी ज़्यादा साल पुराना है. तो वो जो बॉडी ऑफ नॉलेज है उसका हमको इस्तेमाल करना चाहिए. और इन्होंने बिल्कुल नज़रअंदाज कर दिया जो वेस्टर्न डॉक्टर्स है, दे जस्ट रिजेक्टेड आयुर्वेदा एंड अदर एंशिएंट मेडिसिन्स ऑफ द लार्ज ट्रेजर ऑफ नॉलेज दे रिजेक्टेड. तो अभी पर्टिकुलरली जो क्रॉनिक डिजीज है उसमें लाइफस्टाइल में शायद आयुर्वेदा का ज़्यादा फायदा हो. और जो एक्यूट कंडीशंस है, जैसे फ्रैक्चर हो गया या और कोई सर्जिकल है, तो सर्जिकल में डेफिनेटली एक्यूट कंडीशन में एलोपैथिक का बहुत फायदा है. हम उसको बिल्कुल, आयुर्वेदा को भी हम नहीं रिजेक्ट कर सकते, एलोपैथी को भी नहीं रिजेक्ट कर सकते. और मेरा खुद का भी एक्सपीरियंस है, 4 साल पहले मेरे को रेटिनल डिटैचमेंट हो गया था. विथ मॉडर्न सर्जरी आई कुड रिगेन माई आई साइट. सो आई ऑल्सो हैव एक्सपीरियंस ऑफ द मार्वल्स ऑफ मॉडर्न मेडिसिन. बट एट द सेम टाइम वी शुड नॉट रिजेक्ट द treasure of ancient medicine which are more effective in chronic lifestyle disease है. और अभी क्या है कि too much of promotion by allopath, so patients are thinking that drugs will cause miracle. जैसे डॉक्टर सैम ने कहा कि इवन एक्सरसाइज करने के लिए भी लोग तैयार नहीं है. एंड नाउ एंटी ओबेसिटी ड्रग्स आर कमिंग, दैट ओबेसिटी ऑल्सो यू डोंट हैव टू एक्सरसाइज. तो दैट इज अ वेरी गुड. But Professor Sam, आपको your experience with Ayurveda is just 4 years, or you had exposure to Ayurveda earlier also?
The problem is that Ayurveda is not recognized in most European countries or in the West as a whole. So it's difficult for practitioners to have a practice in Ayurveda and not to get sued legally. So it's a bit of a difficult situation. But I knew some doctors who even came from India,
Yeah.
who tried to work as health consultants in Europe and used Ayurvedic treatments and approaches to guide their patients. And those patients were quite often better off and had more results than what we had to offer from the Western perspective. So I'm glad that I'm now able, with all my years here in India, to see what Ayurveda is really doing. And not only Ayurveda, I saw the same results with traditional Chinese medicine.
Yeah.
And yesterday I read a paper in the Times of India that the newly appointed director of the International Indian Medical Association is not really a fan of mixopathy, what he calls mixopathy, namely combining traditional medicine and Western medicine, while research on traditional Chinese medicine is abundantly clear in peer-reviewed studies that in combination with Western medicine, the results are mostly better. I have some friends who are traditional Chinese medical doctors working in China, Hong Kong as well, and they work together. There is no problem. They work together in hospitals. You have the traditional doctors and the Western doctors, and they work together on oncology departments. And the results are very, very good, and even exceeding only the Western approach and exceeding only the traditional approach. So I think we should open up more for each other's perspectives and the things that are beneficial. We should be able to use them and work together to create a good environment for our patients.
Best example of Chinese traditional medicine integrating with modern medicine is the discovery of the latest anti-malarial, Artemisia. That was actually Chinese herb katha. It was a Chinese herb, and somebody noticed the anti-malaria properties. तो इकट्ठे काम करने से if you work together, you will get results faster rather than polarizing. And अभी क्या है कि it is both ways. Many Ayurvedic practice, because there is so much of bad feeling about each other, because you criticize and you say Ayurveda is pseudoscience. If allopathic doctors say Ayurveda is pseudoscience, Ayurvedic doctors also become hostile. They will say all modern medicine is wrong. So both are, you have to find the best in both systems. As so acute conditions, you cannot ignore modern medicine also, and you cannot ignore the traditional medicine, and you have require more research. What happened is when we were invaded by the Britishers 100 years back, or whenever they more than 100 years, so they did not encourage research in Ayurveda. Before the Britishers, the research or the practice of Ayurveda, later it would have become, there would have been more research had they were suppressed as pseudoscience by the colonial rulers. So they have to catch up now. Research all is not. There may be certain things not working also in Ayurveda. There may be certain things which are working. We have to identify by research which are working and make the best use of it. So Ayurveda also requires research. Because those Ayurveda are very ancient science, and we had our masters like Susutra and Charak. So they were very much ahead of their times. But now, if the Ayurvedic researchers take part in joint research with the modern techniques of molecular level research or microscope and other things, ancient Ayurvedic practitioners did not have those. So they did it by trial and error. But among most of their remedies, there may be something like the Chinese drug Artemisia. There may be many things which may come forward if this hostility between the modern medicine and so-called ancient medicine is removed, and they work together rather than ridicule each other. As you have rightly said, some people, they say we do not encourage mixopathy, but that is not mixopathy. Like you said, in China, they have the traditional medicine people working with the modern medicine people. Similarly, I have been visiting Thailand, same thing I saw there. They don't have separate schools. Like India, we have got separate medical schools, we have got Ayurveda separate colleges, homeopathy separate colleges. So they were very surprised when I said we have separate colleges. So they have one college in which they are taught whatever the ancient medicine of that country. So that is one aspect. So as you had said, Professor, you had said about the some sort of commercial interest came in Western medicine, profit motive, with the Rockefeller Foundation and through that Flexner report. I think it was Flexner who started visiting all the medical schools in USA, and those practicing other types of medicine were, disqualified, and only the what was practiced by, say, pharmaceuticals, drugs, and chemical products, and that was modern medicine. And research started, I think, that with a motive to for profit or promoting the pharmaceutical industry. Do you mean to say that?
Yeah, absolutely. And the problem, I think, for Ayush or traditional medicines lies in the foundation of the scientific method that they developed back then. Because the traditional medicine always looks like Antonovsky stated, the salutogenesis. You have to take back control over your own health. Now, traditional Ayurveda or Chinese medicine approaches not only treat the symptoms. They go and look into your mental status, try to find the root causes of your physical issues you may encounter. They will look at your family constellation. They will look at your social determinants of health. What is influencing your health? Where do you live? Do you live in a city? Do you live somewhere in a suburb where you have more trees and more healthy environment to live? Do you have the financial means to providing good food, or do you always have to eat processed foods like chips or, so this is something the Western model never addresses. If you see a traditional medical doctor, an allopathic doctor, they will only look at the symptom. And the problem is the scientific method that has been developed in the West. They consider that the golden standard. And then they want these traditional medicines to fit in that scientific model. But that doesn't work, because in the scientific method, so as we know it today, if you want to prove something, you always work with 1, 2, maybe 3 variables to distinguish the outcome of that variable. Now, if you take a holistic approach like the classic Ayurveda and traditional Chinese medicine, Unani, the whole Ayush, if you want to put that in that scientific model, that's impossible to prove anything, because if you're working on the mental status, and you're working on stress relief, and you're giving certain herbs or plant-based medicine to diminish the neurological impact of your stress features in your body, then you're working on so many components that it becomes impossible within the scientific method to prove something, because you are using so many different angles to treat the patient that you cannot put it in the scientific method. So it's easy for the allopathic model to constantly say it doesn't work. Of course it doesn't work, because it doesn't suit your scientific method. And that's what frustrates me enormously, because the only thing, let's for instance, there are so many good studies, peer-reviewed studies on ashwagandha. There are so many good studies on the use of turmeric. And you see improvements with people who have, and certainly within ashwagandha, who have neurological disorders or have stress-related issues. But that's only one small component of the whole treatment that a traditional doctor will provide you. So that's the only thing we can currently use in Ayush to prove something in the scientific method, is just taking one herb and then state, okay, does it work or does it not work within a population? But that's not the whole range. So it will always remain difficult to prove that Ayurveda as a whole, or traditional medicines as a whole, are really providing a benefit, because the scientific method doesn't allow for it to be research. It's quite simple, in my opinion.
That's interesting, but I have a feeling that even the modern medicine, I mean, so-called modern medicine, it was Rockefeller and Flexner who started giving more on this type of research, that one size should fit all. Before that, the modern medicine, or I mean, so-called modern, nothing is modern actually. Hippocrates was not modern, but modern medicine roots also develop as a holistic medicine. If you see, even Hippocrates says that you should consider everything, the environment, the lifestyle, and
True.
all that. And the old practitioners of so-called mainstream medicine also, even good practitioners today also, they will ask you to indulge in physical activity, control your diet, control your exercise, have good sleep. So I think there is a lot of interface. There can be a lot of interface, almost 70% interface between Ayurveda and good practitioners of modern medicine. I would specify good practitioners, because there are some practitioners who are now just prescribing drugs. But the ancient modern medicine people also used to avoid. I mean, even today, a good practitioner of modern medicine will use the drug as a last resort. But do you think the patients also demand drugs? They have it is the high pressure marketing by the pharma industry, or by that it is the patient, like I have read some accounts where the doctors are saying, "Ki if I don't prescribe drugs, I will lose my patient, they go to some other practitioner." So
Yeah.
do you think it is the doctor, and it's as you said, your patients also 95% forgot the exercises you told them? So
And
you do
that's a
you think?
that's a dependency that we created ourselves. Huh? So that's true. And I see the same. What you're recounting now is what I hear in the West as well. You know, people, there are enough physicians who state, look, I want to help my patient in a dignified manner and want to really address their root causes, but I just can't, because if I don't prescribe something, they don't believe I'm doing my job. So even for a cold or a flu, they start giving a lot of medicines because the patient just demands it. Otherwise, they think they're not being helped, and that reflects on the doctor, because then they state it's not a good doctor because he's not giving me pills. So that's a bit of a vicious circle, which is completely true, and not only in India. I think it's a global problem, and the reason for it lies in the dependency that is being created since we are born. When we are born nowadays, most of the people give birth in a hospital. The first thing a baby can't see in the first few months, but making a bit of a caricature here, but the first thing a baby encounters is a white suit, a white jacket, or a blue suit from a hospital. You know, then you go to kindergarten, and in kindergarten they teach you, or they read stories. If you have a pain somewhere, the doctor will cure you. Then you become a bit older, start watching television series or doctor series. And they resolve everything on television. So it's so deeply ingrained in our consciousness, global consciousness, that the Western model can solve any issue. That we have a firm belief, a set belief, a fixed belief, and that's a bias we all have, that this will cure anything. So it's very difficult. There's the attribution bias. The first thing the first thing you hear, most of the time, is the thing that stays in your head as the reality. And if in the next step somebody tries to disprove what you are thinking, you will neglect it, because I always gave this. I always gave the following analogy. When I was teaching, and I was teaching nursing students at that time, and I said, let's assume you don't know how diabetes starts. And I tell you, and that's the authority bias. I'm the one in front of the academic lecture. So people tend to believe what I say because they consider me an expert. So I told them, let's take a big concrete brick, and I let it drop on my foot. And my foot is broken. And I tell you now that this will lead in 10, 15 years to diabetes. And if you don't know anything, you will believe me. You will believe that what I'm telling is the absolute truth, because I'm the professor. I'm in front of the auditorium, and I'm telling you this. So the first time you come as a nurse into a hospital and you go to a patient and you say, "Oh, you have diabetes. You must have dropped a concrete block on your foot." That patient will look at you and like, "What are you telling me?" So it will be very difficult, even for your colleagues, to persuade you that your thinking is wrong, because the first thing you ever hear is the thing you accept as being the truth. And that's what we've seen, and we still see today when it comes to viruses, pandemics, all medical info. The first thing you ever hear is what you accept as the truth. And it's very difficult to, even if you show proof that it's incorrect what you're thinking, people will still be cognitive dissonant to change their minds. So it will take time. And I think these kind of biases are only, we can only address them if as a medical community, we all work together. And I think a big role is there for governments. Luckily, here in India, you have the opportunity to study different medical degrees. It doesn't exist in Europe. Homeopathy is considered pseudoscience. Ayurveda is pseudoscience. You cannot study for it. You at least have the potential to have research being done. You have the students. You have a Ministry of Ayush. Doesn't exist in Europe. So I think the government plays a big role in this to inform people in a correct manner about the possibilities and, okay, also the potential disadvantages of some therapies. And to change that public thinking, that's those set beliefs, it takes time. But if we want to do so, it takes time, and we have to keep talking about it and just informing people and confront them with their own biases. And then it takes several years before they want to adopt a new way of thinking. But that's okay, I think it's needed in this modern world that we try to at least inform people to think a bit differently on that subject.
So प्रोफेसर सैम कहते हैं कि अगर जो मेडिकल टीचिंग ऐसा होता ट्रेनिंग कि अगर कोई अथॉरिटी ने बोल दिया, कोई टीचर ने बोल दिया कि इसका कारण ये है, तो वो एक ग्रुप थिंक हो जाता है. जैसे उन्होंने उदाहरण दिया क्लास में, उन्होंने एग्जाम्पल दे रहे थे, नर्सिंग स्टूडेंट्स को पढ़ा रहे थे कि अगर मैं ईंटा अपने पैर में गिरा देता हूँ, पैर में चोट आ जाता है, 15 साल बाद आपको डायबिटीज हो जाएगा. तो वो नर्स जाके पेशेंट को वार्ड में जाती है और कोई पेशेंट को डायबिटीज के मरीज को बोलती है, अच्छा आपके पैर में ईंटा गिरा होगा 15 साल पहले. तो वो पेशेंट भी चौंक जाता है. पर वो उसका एक वो एक्सट्रीम उदाहरण दे रहे हैं कि अगर मेडिकल इसमें क्वेश्चनिंग एबिलिटी है, जो कि अथॉरिटी ने बोल दिया, वो नहीं रहता है. जो पढ़ाया जाता है, जो जैसा प्रोग्रामिंग होता है वैसे ही थिंकिंग होता है. So I think Professor Sam, you are saying that medical education takes away the power of questioning and critical thinking. The teacher in
Absolutely, and that's what I encountered myself. I studied. I had a firm belief that what I was doing was correct. And once I hit the practical side, I saw it wasn't working. And then it's difficult it was even difficult for me to accept that my treatments had boundaries and weren't effective within the whole population, because there are so many variables at play. So I needed to broaden my vision. But it's true, and I think that's the major issue we see today. If new research is published, it takes up to 20 years to reach the health professional working in hospitals, clinics, etc., etc. 20 years. So most doctors in any kind of medical field notice there is a huge discrepancy between research being done and what they are doing on the working floor. And that's a gap that we need to bridge as well. Because most doctors that graduate think, I know everything. And the only thing they know is that a pharmaceutical company steps into the office, say, this is a new drug for this disease, and the doctor doesn't think anymore. He just starts prescribing. So the critical thinking and doing your own research should be stimulated within the medical health professionals themselves, because they don't do it anymore. And the reason behind it is because, and I saw this at my own colleges, the research departments didn't communicate with the medical department, the teaching department. So the people who were teaching medicine quite often weren't involved in research. They were quite often totally different people. And there was little to no connection between them. So the researchers, they were in their labs and they were thinking about something, hypothesizing something, finding a result, publishing it in peer-reviewed papers, came to a conclusion, but the professors teaching didn't know these new novel insights. So what happens is that it's like a car mechanic. An apprentice at 14, 15 goes to work in a workshop of a car dealer, and he learns by what his superior is doing at the car. He's just copying the same ways of working. He's just copying the knowledge of your guide at the work floor. And I'm afraid that a lot of people think that medical health professionals are very critical thinkers, which are not, because I saw it in my own educational system. I wasn't allowed to question anything. If I posed a difficult question, they just said, yeah, but that you just have to, it's what's written here. You just have to copy this. So in essence, a doctor that gets trained is at the same level as a car mechanic. You just copy. The professor is telling you something, you just copy that and you start doing that yourself as a new doctor, without having the broad knowledge of the science and also the scientific uncertainty, being able to recognize that not all science proves anything. It's not always a causal connection. You have to be aware that even the science is an uncertain thing, that keeps changing and evolving over time as well. So we just have to appreciate the fact that we don't know everything and be able to admit that as well, and be critical thinkers for ourselves, but open up between these different layers. Like health professionals should connect more with the science, and the researchers should connect more with health professionals to interact and to develop new theories and also new treatment plans. And that happens not often enough. It's like with statins, it's like with chemotherapy. For statins, we already know for 20 years that they don't contribute in the primary prevention of cardiovascular incidents, but it's still the third most prescribed drug in the world. Why? It's because there is a gap between the knowledge and the science and what health professionals have been thought to prescribe for a certain issue. That's one of the examples.
Sam, you told about car mechanic. It took me back almost 50 years, more than 50 years. I had just joined medical college. It was the year 1972. Our dean was a professor of medicine, very learned person. He was FRCP those times, and he came for our introductory lecture. And we were all very happy. We had just entered medical school, so we thought that after 5 years we will be just like God. We will cure everything. I mean, that is when you are medical students, you don't know the limits of medicine. And we were very happy. And he congratulated us. Then he says, "You think you are going to be next to God?" Then he asked, "I'll just give you an example. What is the status of a doctor?" He said. He says, "Does any one of you know how to drive a car?" And those days in 1970s, we had very few people had cars. We used to have bicycles only. So there was one girl who raised a hand. So he asked her, "Suppose you are driving a car, your car breaks down in a village. What will you do?" There is no car mechanic also. There is only a cycle mechanic. So she said, "I'll go to the cycle mechanic." He says, "Okay, you go to the cycle mechanic. He will open the bonnet. He may just see there may be some loose wire. We may connect it, or something, some screw and some spark plug." And that is his limits of knowledge. And by chance, the car may start. But suppose if there is a major problem in the car, he will be clueless. Well, you should remember, however much degrees you acquire, medical degrees, how much experience. As a doctor, when you approach a patient, your level of knowledge is of a cycle mechanic trying to repair a car. So it is as limited. And other things you may be able to fix, like the headlight is broken, so you can repair the headlight. Tire is punctured, the cycle mechanic so it is something like, as we were talking, your surgical, anything is externally broken, like your bones are broken, it can be fixed. I got a retinal detachment, the headlight, it could be fixed. But what is happening, so many other things in the body, biological mechanisms, biochemical changes, which are beyond still to be researched, which we do not know. So that is why our approach is a mechanical model. Modern medicine, I would say, is a mechanical model. We are seeing each part at a time, and now we have got specialization. So it is becoming more and more mechanical, forgetting that the human body is more than its sum total of its parts. So we are losing that. But as I said, and questioning is not there. While another thing you mentioned was the critical thinking is missing in doctors. The knowledge is there. That is second-hand knowledge. First, given by what is given in the textbooks, that may be a little outdated because the textbook doesn't catch up with the research. The teaching doesn't catch up with the research. So there is a gap between that. And secondly, by the pharma industry, they promote the drugs to the doctors, and they prescribe the drugs which are given by the medical representatives. So they don't have the time to do the reading, they don't have the time to critical. So that reminds me of another teacher we had that he was Dr. J.E. Park. He had that time also, he was very famous, and we are still having his textbooks in medical schools in India. He was a professor of preventive and social medicine. We have a major subject of preventive and social medicine. I think in European here also they are having social medicine or public health, they call it now. So he was a professor of preventive and social medicine, and his textbook is still running. He is no more now, he died long back, but his textbook is still in its 25th edition. And he was a professor. So we were very scared of his thick book. So whenever we used to, in the exam, he used to ask us questions and we will get stuck. So he used to say, you have to read my book from cover to cover. You have not read my book from cover to cover. So we used to get stuck. Then one day in class, he said, I can give you another option. You may read my book from cover to cover. You may not read my book from cover to cover, because what is given in my book will get outdated in 10 years or you will forget. But if you can develop three qualities, one is the creative thinking, second is the critical thinking, and third is the courage of conviction. So if you develop these three, you need not read my book. So I was so happy. Next time when I went to the exam, and again I was in front of him. So he asked me one question, I got stuck up. He says, you have not read my book from cover to cover. I said, sir, I will follow the three C's. I will follow creative thinking, think on my own, critical thinking, that if someone else think, I will try to weigh how correct it is or what are the gaps. And I will. Then he told me, young man, in your long career ahead, you will find the three C's are more difficult to follow than read any book from cover to cover. So I did not realize it that time. Okay, I thought here he just, I thought, what is so great about it? So after so many years, this last 5 years, when the pandemic came, and then I realized that the whole medical world seems to have surrendered critical thinking, courage of conviction, or creative thinking. Like we had so many drastic measures, nobody critically, some people must have thought, but they did not have the courage of conviction to speak. And those who had were victimized. Like you had the courage to speak, you lost your job. Many people, many lost their job. So it was difficult. I mean, it was difficult. Those who lost their job, it is difficult. Many who did not have the critical thinking. Many did not have, even today, I think 50% of doctors will really think it was required. These restrictive measures were required. They will not question. As you said, whatever the authority says, and this is one of the, even Albert Einstein also had said, unquestioning respect for authority is the biggest enemy of truth. You are unquestioning respect for authority, be it a medical authority, and be it and I think the greatest authority who caused all this harm, who has been pardoned by Biden, is Anthony Fauci, because he was the biggest authority. He was the editor of Harrison's textbook of medicine. So nobody questioned him. Nobody had the. So anything about all this, this WHO also became an authority. WHO became an authority, and everybody accepted unquestioned whatever the WHO said. And they were trying to bring in the treaty also, or they are still trying. So any thoughts on this WHO treaty and about this Trump signing of withdrawal from the WHO? What are your thoughts on this, Sam?
Yeah, it's a combination of the treaty and the amendments on the international health regulations, which dates back from 2005. I always had the feeling that the treaty wouldn't come to effect. And the reason for it is because, like India, during the pandemic, you followed more or less your own approach. I still remember when I arrived here in India during the pandemic, you were able to get these pouches at the pharmacy containing ivermectin, azithromycin, the things that would potentially be beneficial. These were forbidden in the West because the WHO stated there was no proof that it was efficient, although the proof was there. But that's another story. But so I always had the feeling there are too many governments, certainly in the global South, that felt pressured by the WHO, that felt like they don't have to tell us how to work upon our own public health. We have the experts, we have colleges, we have people doing research here. Okay, most countries followed the lead of the WHO to a certain extent, but India gave it its own, more or less their own vision on how to handle the situation, which I think was good and better than what the West did. So I knew that the treaty won't pull through because there's too much opposition. A lot of countries, and certainly in the global South, saw that the WHO was just a Western-steered organization that wanted to implement its vision on the worldwide scale. And I don't think the treaty will pull through. And if it pulls through, it will be so weak that it doesn't leave any power to WHO. But what I do think, the WHO became too powerful. And that is something that we have seen during the pandemic. And let's be honest, if you looked at, I was completely unaware how the WHO was funded before the pandemic. I didn't really have any insights on that until I started looking into the data, which they publish themselves on their own website, so you can just find them. I saw that most of these, I saw one person, Bill Gates, was in the top 10 of the funders with different organizations. So he was there with the Bill and Melinda Gates Foundation. He was giving money through the Gavi Alliance. He's also one of the biggest sponsor of the Wellcome Trust, which was always also there in the top 10. So you saw these different organizations that were basically funded through one person. And then I started to worry because he also said, I want to decide what public health becomes on a global scale. And then you see that the WHO became also biased. And the moment that Trump came into office in his first term, he already retracted the US out of the WHO. And what happened was that Bill Gates stepped up and said, I'm going to fill that financial gap, giving him even more control. So there you can already tell, and that's something that was also found by Dr. Tess Lawrie. She's one of the founders of the World Health Council. She's a researcher, and she produced a video of 20 minutes during the pandemic. I forgot the name, but it's still online to be found. And there was a professor from the Liverpool University who was asked by the WHO to make a review on the efficiency of ivermectin in the case of COVID-19. And what happened was that I read the study, the review. There was a big review, systematic review, and I read it, and I was like, all the data show that there is efficiency, that it does work, it does work against COVID-19. It diminishes the symptoms and it diminishes the duration of the disease. But when I came to the conclusion, I read literally that there was no proof that ivermectin was beneficial as a treatment for COVID-19. What did Tess Lawrie do? She knew this professor, did a Zoom call with him, recorded that Zoom call, which took 20 minutes, in which that professor from the University of Liverpool eventually, literally said, I didn't write the conclusion. And he also stated who did. You can guess two times or even once which organization wrote the conclusion. He just admitted it. He plainly admitted it. And he also agreed afterwards to publish this video online, which happened, which basically, I think, ruined his career because we never heard from him again. So that's how biased the WHO is. And I think what should happen on a world, and already wrote an article on this, I think governments should retract from the WHO and set up their own national structures. Most of countries already have a public health department, and appoint in these national departments only experts that have no ties with the pharmaceutical industry, that have no sponsorship or conflict of interests with any potential organization that might bias their decisions or conclusions or ways of thinking. And that you really have experts like you're an emeritus now, you would be perfectly eligible to sit in these kind of national departments because you're not liaised to anyone anymore. And you can talk and speak freely. And you can think freely. And this is what I think is needed. And the WHO should only remain present in our global community as a data center, collecting data from around the globe on all kinds of health issues, communicable, non-communicable diseases, so that governments can use the WHO for data gathering and for also creating for themselves new novel insights. But we should abolish the WHO. That's basically what I think that should happen, because this is not an autonomous organization. It's biased because there are so many philanthro-capitalists involved that sponsor the WHO, but in the meantime earn a lot of money if they implement the policies of that philanthropist. This has to stop. As long as money is involved at that highest level, then we cannot talk about safe public health. And I think every government should realize that having a healthy population leads to a happy population, leads to economic growth, leads to well-being for all. And I think that's what all governments want. If you want as a country to grow and become successful, you need good public health as the basis of everything in a country. So I think all countries should and governments should realize that giving up on the WHO will contribute in public health on your local level enormously. Because all countries also have a different approach. During the pandemic, for instance, there was a one-size-fits-all approach promoted by the WHO. But you in India have an average age of 25. That approach can never be the same as what they wanted to implement in the West, because in Europe, the average age is 47. So you have totally different variables at play in the West that make people more vulnerable for diseases. So how can you implement as one global organization the same one-size-fits-all approach that India has to follow, that Europe has to follow, that America has to follow, while you have a totally different array of variables at play? You have a totally different demographic. So it doesn't make sense to have a global worldwide organization at all. The only thing that can be beneficial is to have a global centrum of data gathering so that all governments can use that as a reference point. But that's my personal opinion, of course.
Thank you, Sam. I think we can wind up. Just to sum up, what we discussed is that ancient medicine has to work, or modern medicine has to work with the wisdom of ancient medicine. Both should be integrated. And other thing is that whenever the policymakers' decisions, be it the WHO or any other organization, should be free from conflict of interest, some free from influence of big pharma, and the vacuum in WHO because of financial aid. A lot of people with vested interest started controlling the WHO. So we should make WHO a neutral organization as a data bank, and policy decision should be at the country level, because the epidemiology of disease, the demographics differ from country to country. The local experts will only have the correct picture of the country and what measures to apply, and the data, they can fall back on the data at global level, which is with the WHO. It should not have any say or any executive power. So I think we can thank you, Sam, for a very exhaustive yeah, I think this would be very interesting to our viewers. Thank you everyone. धन्यवाद.
Thank you for the invitation.
Thank you.